So when you look at global healthcare systems, especially in developing nations, there's one challenge that just consistently acts as a bottleneck. It's the last mile.
The last mile.
We're talking about vast areas, impossible terrain, washed out roads, or, just a complete lack of ground infrastructure.
Right, and that means vital, time-sensitive medical supplies, blood, vaccines, antivenoms. They just can't get where they need to go fast enough.
And those hours, or sometimes even days, they cost lives.
It's a persistent, often deadly logistics problem. And ground transport, it just can't solve it in places where the road networks are so fragmented. Which is exactly why today we're diving deep into Zipline.
Zipline, a California-based company that didn't try to, pave better roads.
They decided to fly right over them. Since launching the world's first national drone delivery service in Rwanda back in 2016, they have, and this isn't an exaggeration, they've fundamentally disrupted how essential goods move.
And their stated mission is, well, it's incredibly ambitious. They want to create an instant, equitable logistics system for the entire world.
For everyone.
To make sure essential goods are available to everyone, no matter their geography. And that kind of systemic change, that takes more than just cool tech.
Oh, absolutely. It requires a revolutionary business and regulatory model. And that is our mission for this deep dive. To unpack that blueprint, we're going to look at Zipline's surprising beginnings, which involved a pretty dramatic pivot.
Right, from a completely different industry.
We'll cover the specific technology they engineered for these austere conditions, the fixed-fee government partnership that made it all scalable, and, critically, the hard data that proves it works.
Okay, so that journey starts with a moment of, intense moral clarity. The co-founder and CEO, Keller Renato Clifton, he originally launched a venture called Romotive.
Romotive, right back in 2011.
And they were building smartphone-controlled toy robots.
I know. It's hard to imagine a bigger disconnect from saving lives, isn't it?
It really is.
And Renato himself admits that despite some early success, he grew really disillusioned with what he called novelty gadgets. He felt this deep desire to redirect his team's expertise in autonomous systems towards solving, bigger problems.
So in 2014, they just radically reinvented the company. Romotive becomes Zipline.
And the focus becomes entirely humanitarian.
So what drove that specific focus? I mean, we hear about problems in the abstract, but what was the moment that really crystallized the need for this?
It was direct observation. The founders actually traveled through these low-income regions and just saw the inadequate, fragmented supply systems firsthand.
Okay.
The real aha moment came in Tanzania. They encountered a government database, and this database was logging hundreds of preventable deaths.
Preventable deaths.
Yes. And I mean deaths caused solely by the lack of timely access to critical supplies like blood and medicine in remote hospitals.
Wow. So it's not that the medicine didn't exist in the country, it just couldn't get there in time.
Exactly. That defined the problem for them. They realized that critical failure was logistics. They kept hearing that all these well-funded health initiatives, vaccine drives, malaria treatments were getting, quote, stuck on logistics.
So a drone becomes the logical answer. You just bypass the bad roads entirely.
You leapfrog them.
Yeah.
So they engineered a specific solution for these low-resource environments.
Let's talk about the tech. What defines the Zip drone? What makes it work in these challenging conditions?
Well, these are highly specialized, autonomous, electric, fixed-wing aircraft. They're built for reliability and speed, flying up to 70 miles per hour.
And a round-trip mission is what, about 75, 80 kilometers?
That's right, and they have to be weather-hardened. They need to handle unexpected wind, rain, all the diverse terrain you find across Africa.
But the thing that strikes me as, truly ingenious is the zero infrastructure requirement at the receiving end.
That's the key.
Most drone projects, they need landing pads, complicated procedures, power.
And that was the critical design choice for scaling. The drone just descends low and performs an airdrop. It releases the package, which is stabilized by a small paper parachute, and it floats down to a little clearing near the clinic.
So no runway, no special equipment, not even electricity is needed at the health facility.
None. Absolutely zero.
And ordering is intentionally simple, right? It has to be.
Completely. It has to be seamless and low-tech for the user on the ground.
We're talking text message, WhatsApp.
Or just a simple phone call. All the complexity is managed back at the distribution hub, which they call the Nest.
Okay, so walk us through an operation at the Nest.
So the Nest is basically a regional micro warehouse and flight control center. It has inventory storage, crucial cold chain facilities for blood and vaccines,
right,
and a flight operations room. An order comes in, staff package the item. It's about the size of a shoebox. They attach that little paper parachute, and they load it onto the zip.
And then comes the exciting part, the launch.
The launch is, well, it's pretty dramatic. It's catapult style. It goes from 0 to 100 kilometers per hour in just a fraction of a second.
Wow. And that rapid deployment means the average delivery is completed within. What's the target?
The target is 30 minutes of ordering. Whether that clinic is 5 or 50 kilometers away,
Okay, that 30-minute window is incredible, but we have to address the payload. It's pretty modest, right? About 1.5 to 1.75 kilograms.
it is. Enough for maybe 3 units of blood.
So how do you justify that compared to, say, a motorbike courier who could carry 50 kilograms?
It's a trade-off that's absolutely central to their strategy. They're optimizing for urgency and reliability, not for volume.
So that motorbike can carry 50 kilos, but it might take 6 hours, if it even makes it at all.
Exactly. Especially during the rainy season. Zipline focuses on high-value critical goods, where speed is literally the difference between life and death. The small payload keeps the drone smaller, faster, and more reliable,
And it's electric, so it's quiet, zero local emissions.
which is a nice sustainable bonus.
So that optimization really set the stage for scaling. And the first proving ground wasn't some Western country, but Rwanda.
Yes, Rwanda. They became the pioneer, launching the world's first national drone delivery service in 2016. And their initial focus was incredibly strategic.
On-demand blood supplies.
For 21 remote hospitals, directly targeting postpartum hemorrhage, which is a leading and tragic cause of maternal mortality.
And this partnership was revolutionary. It involved real systemic change. They adopted this centralized inventory, decentralized delivery approach.
That's the key phrase. It meant the National Center for Blood Transfusion could just hold all its blood stock centrally, preventing wastage at the clinics. Hospitals just ordered units as they needed them.
And crucially, Rwanda's Civil Aviation Authority basically co-developed the regulations with them, allowing for routine beyond visual line of sight or BVLOS operations.
BVLOS, that's the magic term. It means flying drones autonomously beyond where the operator can physically see them.
And that trust from the government must have been the crucial enabler for national coverage, right? Otherwise, you're just doing small-scale tests.
Absolutely. Without BVLOS, you're just flying hobby aircraft. Rwanda created the regulatory environment that treated Zipline as a public utility, a safe, routine, national-scale service. And the results? They are staggering.
They really are. By 2020, Zipline was fulfilling over 75% of all national blood deliveries outside the capital city.
And we saw a study in The Lancet showing a 67% decrease in blood product wastage due to expiration.
Because clinics weren't forced to overstock anymore.
Exactly. But the most profound metric is the direct health impact. Analysis linked Zipline to a 51% reduction in in-hospital maternal mortality from postpartum hemorrhage in those regions.
A 51% reduction just by making blood available in 30 minutes instead of 3 hours.
It's not just a commercial success, it's a transformation of public health equity.
And that success became the blueprint for the next major scale-up, Ghana, launching in 2019 on an even larger canvas.
It's much larger. 4 distribution centers serving up to 2,000 health facilities and 12 million people.
And in Ghana, they immediately diversified the scope. Not just blood, but vaccines, antivenoms, other essential meds.
And the data there is just as compelling. An evaluation funded by the Gates Foundation found that facilities served by the drones were 42% less likely to have vaccine stockouts,
And they resolved stockouts 60% faster.
which translates directly to better community health.
A 2022 study found an increase of 13 to 21 percentage points in full immunization coverage in the regions Zipline served.
That is a massive jump.
It's a profound impact. It's why Ghana quickly became this high-volume hub. They completed Zipline's 1 millionth worldwide delivery in late 2023.
But that scale requires deep pockets. So this is where the business model, which is arguably the real innovation, comes in.
Yes.
We mentioned it earlier, but we have to dig into this. It's a public-private partnership. The Ministry of Health is the client, the primary long-term client. It's not individual resource-strapped clinics paying per delivery. That would never work.
So the model is a fixed price per delivery with a guaranteed minimum volume. It's essentially a subscription.
You have to think of it like a public utility, like electricity or water service that the government pays for. That remote clinic incurs no direct charge to order a life-saving delivery. They just order it.
That reframing of drone delivery as a utility rather than some luxury tech project is politically brilliant, isn't it?
It is, because it lets governments budget for logistics as a stable, predictable cost. It creates political sustainability and ownership.
And it de-risks the whole project for the host country. They transfer the operational risk, the maintenance, the tech obsolescence risk, all of that goes to Zipline.
And in return, the government gets a guaranteed service level. It moves the whole dynamic away from aid dependency and toward a managed, accountable service contract.
I know early phases were de-risked by grants from places like Gavi and the Gates Foundation, but the goal was never to perpetuate that.
Exactly. And that transition is accelerating. I mean, look at the recent U.S. State Department commitment, up to $150 million under a novel pay-for-performance model.
So the money is only dispersed as Zipline actually hits specific coverage targets.
Right. It links private capital directly to measurable development outcomes. It's incredibly efficient.
Okay, but what about the human side? This is complex aerospace tech, often in very remote areas. What about maintenance and dependency on foreign specialists?
That's a crucial point, and it's why local capacity building is, for them, non-negotiable. Zipline emphasizes integration. 100% of the staff at the Rwandan and Ghanaian distribution centers are local hires.
So they're creating high-skilled jobs, flight operators, technicians.
Exactly. It combats the dependency issue and makes sure the technical know-how is deeply embedded in the local workforce.
So Zipline isn't trying to replace the existing medical supply chain. They're a precision bridge.
A bridge between central medical stores and remote clinics. They just manage that final critical sprint on behalf of the Ministry of Health.
And that blueprint is now being replicated in massive new markets. You mentioned Nigeria.
Nigeria, where the plan is for over 20 distribution centers. They've already delivered over 1 million vaccine doses in just one state. And we're seeing growth in Kenya, too, around Lake Victoria.
Let's pivot to the systemic improvements. Beyond just the deliveries, by creating this agile, centralized inventory, they've reduced the need for clinics to overstock or understock.
Which means remote and rural communities are getting comparable rapid service to urban centers. It's shrinking that urban-rural health gap.
And this network, it wasn't just built for normal times. It proved its resilience during the COVID-19 pandemic. That was the ultimate stress test.
A huge stress test. They quickly repurposed the network to support diagnostics. Drones started transporting COVID-19 test samples from remote districts to centralized labs in Ghana.
And what did that do to the turnaround time?
It cut delivery time from maybe 6 hours by road down to just 30 minutes. That drastically accelerated testing, contact tracing, isolation, all the vital pandemic response stuff.
And then when the vaccines arrived, their cold chain network was already in place.
Ready to go. Ghana used Zipline to deliver the world's first COVID-19 vaccine by drone in March 2021. They maintain that critical cold chain integrity all the way to these remote villages.
Plus, the contactless delivery minimized infection risk.
It just confirmed the network's foundational value during a crisis.
So when you step back and you synthesize all of this, Zipline's work contributes directly and, measurably to key global development goals. You have SDG 3, good health.
Absolutely. Saving lives, raising immunization rates.
And SDG 9, innovation and infrastructure, building this novel aerial infrastructure that just leapfrogs the need to build roads everywhere.
And you can even add SDG 13, climate action. These electric drones emit 97% fewer greenhouse gases than an equivalent car trip. It's making health logistics greener.
It is truly fascinating how this company went from a quirky robotics idea to a massive, scalable, self-sustaining public service model that is transforming health logistics.
And the success really hinges on that fixed-fee government partnership and the commitment to building local capacity.
Which brings us to a final provocative thought for you to consider.
Go on.
The case of Zipline shows that developing nations like Rwanda and Ghana, they aren't just recipients of aid or technology anymore.
No, they're not. They are now leaders in adopting advanced, large-scale autonomous systems for social good. They are setting a global precedent, a blueprint for how cutting-edge innovation can accelerate development outcomes, often years before similar solutions become routine in wealthier nations.
That reframing of the narrative from aid recipient to global technological leader is a really powerful insight. Thank you for joining us on this deep dive into how technology, guided by a social purpose and a brilliant business model, can bridge that gap between innovation and equity. Keep exploring.
Thank you for listening to Mission Possible, innovating for the world's most marginalized. This podcast is built on the outstanding work of our students, whose curiosity and commitment drive much of the research and storytelling you hear. Each episode is grounded in academic research and shaped through close collaboration with our partners. To learn more about the research and partnerships behind this podcast, feel free to contact us. Thank you for joining.